Well, I appreciate everybody joining us today. I'm absolutely thrilled to be talking in conjunction with Dr. Youre Periman. And the reason that I'm always thrilled to talk to Laura, not only is she a great friend, but every time she speaks, I listen to her, speak with her, I learn something. So I think that this is just a great opportunity, and particularly because we both believe so much in comprehensive treatment, and you can't really have comprehensive treatment without integrating over-the-counter products. So Laura, thank you very much for joining me. If you wouldn't mind telling a little bit about your practice, I think it's absolutely fabulous what you are doing and what you're continuing to do. So if you wouldn't mind sharing that.
Oh, thanks, Doug. First of all, that was a lovely introduction. And second of all, I feel the same way about you. Every time I listen to you, I always learn something. And you've been a big inspiration to me because we've been talking about this for years. It's like, Doug, I really want to create my own eye center. And I don't know, it's kind of scary. And you're like, LP, you can do it. And you've been there for me all along the way. So I thank you very much. But I heartily agree with you that OTC foundational therapy is pivotal and foundational to everything else we do as a dry center of excellence. And now I have a cute little clinic in Seattle, Washington, where all we do all day long is dry eye. And some people might think I'm crazy, but it's so fun. And I'm learning more and more all the time. It's so awesome.
You can have a financially very successful practice by doing it. And I think that's what's remarkable. And we're just talking about, the majority of people aren't going to do what we did, which is strictly have a dry eye clinic. But it just shows the integration into the practice and how it can be successful. And I think that one of the things it does is it stops confusion, because when you turn patients into this aisle with supplements, with artificial tears, with eye products, they're going to get confused. Many of the products are labeled same as this product, same as that product. And ultimately what people end up doing is gravitating toward the cheapest product. And the problem is they still hold us accountable, even if they made some other decisions. So I think that's what the important aspect of over-the-counter products is, because we need to give that direction. We need to help that patient out.
100% agree with you. Like, I'm overwhelmed just looking at that. Like, I'm the kind of girl that can't shop at Costco or an IKEA. I'm like, it's just too much. And I go to the eye drop aisle just as a basic example. I'm like, oh my stars, it's so overwhelming. And then let alone the supplements, which are not the same. We have to make a clear and directed point about which OTCs.
Well, that's so interesting you mentioned that. And I'm going to, as we get into supplements as part of a key part of, of over-the-counter products, kind of how I gravitated and how I made some of the choices that I did, because of that people thinking things were the same. So really, whether it's you're running an advanced dry clinic, or, you're trying to just add it into the clinic flow, because I mean, right now, when we look at dry eye, probably one of the greatest opportunities, the greatest pathology that's going to present in any optometry or ophthalmology clinic is ocular surface disease. And we can either do two things, and I think it's become so abundantly clear with this pandemic, is that we can either try to see more patients, which is extremely difficult, or we can provide a higher level of care for our patients that we're seeing by treating other disease entities such as ocular surface disease. And that's where the OTC products really do play a key role.
Yes.
So, and the advantages really in looking at OTC products is that they really are very easily accessible. There's no insurance hassles whatsoever in doing this, because none of them covered. Now, with that said, I'll say make sure you give your patients a receipt, because if they have a health savings account, they can actually use this, since it's a doctor that's prescribing that. So I think but I've found it absolutely essential for baseline therapy as well as adjunctive therapy, and it just makes your therapeutic plan click better, or maintains what we've done with some of the procedures. Like I said, just extend the life of the procedure with this therapy. And I think the most important thing is that there is no magic bullet. The difficult part that sometimes our patients have is they're used to, I have a bacterial infection and I take an antibiotic and I'm better. I have a sinus infection, I take a medicine and it's better. And there is no magic tool. And I think one of our cataract surgeons said to me so well at one point, he just kind of looked at me and said, Doug, there's so many ways and so many underlying etiologies allergies, for ocular surface conditions. You know, I see a cataract, I do a cataract. And it's so many complexities in that, that really what I want from you is tell me when they're ready to operate on. And it really is boils down to that. And that's where the role that primary care clinicians and dry clinicians play in that surgical and entering that surgical arena, is we love to see those patients treated before they actually hit the clinic. Your comment on that, being a surgeon?
I love that analysis, and really I think it speaks to the whole eye care ecosphere as it surrounds the patient in the journey of their lifetime vision. So catching these things early and preventing that tanker truck from slowly crashing into the rocks is everyone's responsibility in eye care. We're all passionate about preserving vision and quality vision, and dry eye disease can affect visual quality, silent reading speed, quality of life issues. So I think it's incumbent upon everyone in the eye care ecosphere to pay attention to this. And it can start as simply as a mindful recommendation of the right OTC products.
Yep, I agree. And after all, that's what we're doing in the profession, is we're taking care and improving the quality of vision, where it's spectacles, whether it's contact lens, where it's surgical, it all dovetails into the same thing. What we're interested in, giving the patient the best possible vision that we can as providers. So, and when we take a look, and we're going to kind of delve into these a little bit more, but when we take a look at all of the different dry eye products that are out there, and looking at supplements, looking at scrubs, looking at home treatments, and I mean, we have a lot, and I think that's what we're going to kind of help distill down is, you know, today is, what do we find as some of our foundational treatments that we're going to do, and why have we made some of those selections as we go along? You know, we also have the heat masks, we have moisture chamber goggles, and artificial tears. And as insignificant as you think artificial tears would be, they're not, because patients don't know what to do with those. And to just simply give them a handful of tears and say, use what works, is not directing your patient. It just is, you know, in my opinion, ill-advised, because you're just not giving the direction. And if you take that with your own healthcare and into another subspecialty that you go to, and a doctor says, well, just do what you think is going to be best, you'd say, okay, but what do I do about this arm I can't use?
Or if your doctor says you need more protein in your diet, it's like, great, I like salami and pepperoni. It's like, yeah. That's not what they meant.
That's right. That's absolutely correct. So, you know, and when we take a look at simple advice and making recommendations, I think it's so important. And I know that we're seeing more and more interest in eye care providers. And, you know, Laura, why don't you kind of handle and talk a little bit about makeup, since I know nothing about it.
I love makeup. I'm kind of a makeup junkie, full disclosure. But we presented a work at Arvo 2017. There are multiple people on the. I'm happy to give you the reference. But we were able to show through a dry eye survey that patients who took the time to remove their makeup had lower speed scores. So this has become a part of it. This is my beautiful right-handed. This is my right-handed clinic. This is Raquel, and she loves makeup. She loves going out and looking great. This is all BC, before COVID. But anywho, she has dry eye as well. And when she doesn't remove her makeup at night, then her eyes really notice it the next day. And so the series of photos is in, you know, full going out makeup after a makeup remover in the next line down. But then she went after it with a second makeup remover and still got more product out. And then the bottom photo shows after all those cleaning steps, plus the new lids, the mesh cleaning, and that got her clean, got her comfortable. We got to get all that stuff off before we go to bed, because we don't want it hanging out in full contact for hours at a time while you're sleeping. And you don't need to look beautiful. You can just think beautiful and dream beautiful. You don't need to be beautiful.
And you know, when I look at this and talking to patients and talking to patients about that, it really is it's so frustrating for me, because it's difficult, with the exception of taking off makeup remover and sometimes being careful of the amount of makeup that you put on, what to do. But I would tell everybody on this, stay tuned. Stay tuned.
Yes, there's more going on here and that we can explore, but that'll be next year.
And what that does is, and when we do have those, that's going to dovetail so well into really helping guide your patients that suffer from ocular surface disease, right down to their makeup. So I would say to that point, stay tuned. I know there's some great stuff coming on that. So we'll really talk about some of the applications. And I think when we take a look, you say, what is it that we're trying to do? We're looking at inflammation, we're looking at MGD, we're looking at maintenance, we're looking at aqueous deficiency. Laura, you want to tell us about some of these and how we're addressing this and what our thought patterns are?
Sure. So this is a simplified version of how I think about ocular surface inflammation and the whole dysfunctional chaos that's going on there. I don't really split aqueous and evaporative anymore. I view them as a double vicious circle, like a couple of hyped up puppies rolling over each other, COVID puppies even, rolling over each other, egging each other on. But this is a simpler way to look at it, addressing all these different components of what we see on all of our dry eye patients. There's inflammation is present, and things like HydroEye are brilliant and strategic and have fabulous biochemical science, clinical science supporting its use for reducing inflammation. I have a fabulous case to share with you later.
I'm really glad you mentioned that whole not siloing and trying to say inflammation, MGD, aqueous deficient, because I feel the same way, Laura. I feel that through my clinical practice over the years of treating this, that everybody physiologically is on that continuum. And some people may advance more and have more inflammation, which causes more aqueous deficiency, which causes an acceleration of MGD, and other people are just different on that spectrum. And so I know I completely agree with you that that's the case. And the case in point I always like to make is, let's look at the consummate aqueous deficient patient, and that's got to be a Sjogren's patient.
That's right. But have you ever seen a Sjogren's patient without MGD?
No, I'm still
That's
looking.
the point. Yeah.
And I think the important parts is when we get down to that blue box in the bottom right is now we're looking, I like to get patients conditioned before I start my therapeutic, before I start my procedures, is that your physiology wants to gravitate toward obstruction, inflammation. And so we're eventually, and I'll tell patients, in my treatment, what we're going to do is we're going to start off very aggressive. And I want to take on this spectrum and I want to back it up to the point that you're more comfortable. And then ultimately I'll have you on the least amount of treatment that will maintain that level and stop any further progression. And what that is, I don't know until we get there. Right. But that's where that blue box comes in maintenance. And honestly, my goal is if I can get people where they are maintaining with over-the-counter products, that is a huge success, that their physiology allows that we can back it up and we can get them to this point. That is absolutely a huge success for me when we
That's
do
right.
that. So I think what we need to do is, you really have to be discriminating when you're looking at over-the-counter products, and really, use something that's proven effective, easy to use, is cost-effective for your patient, and then it gets into, and years and years ago, I would write these very sophisticated treatment plans. Well, I thought they were sophisticated, very sophisticated treatment plans, and the patient would come back and they go, "Yeah, Dr. Devries, I really didn't start that because I went to 2 different places. I couldn't find this and I didn't have that, but I got this instead." And you'd say, okay, they're still holding me accountable because they came back for the visit. Their dry eye isn't any better. And I realized that I have to do more. I have to do a better job on that front. Similar experiences, Laura? Or?
Yes, it's like you were there with me on my clinical journey. And we've been friends for a long time and sharing our journeys for a long time, but absolutely, I agree.
Yeah. I think a great example is HydroEye. And let me kind of the backstory of how I happened to start using HydroEye. I had stopped recommending oral supplements to my patient because I would spend all this time, they'd be on an expensive omega-3. I would spend all this time on the patient, and then they would come back. And so I just got so frustrated that they would shift to what they thought was equivalent, or they would go to a health food store. And so when I found something like HydroEye that had gamma-linolenic acid in it and the science behind that, I knew that there wasn't a substitute. So I wanted to get somebody on something that I knew would work. So what I did is I took about 200 patients over the course of a month, and that was the only thing I changed. was putting them on this supplement, and the results were overwhelming in terms of patients say, now we're talking. And so that was how I happened to get a quality product. But it was because I had people making their own choices and thinking that they could take one omega-3 that was, or a 369 from a big box store, and that would do it.
I love that journey. That's super cool. I have a case coming up that I'll share with you how I came to be a HydroEye fan, that I think you'll find that dovetails right into your experience as well.
And for the audience's purposes, the reason we're talking about supplements is it, for most of us, it becomes baseline treatment. I mean, we're going to do the other things. We're going to use the immunomodulator. We're going to address procedures, but we want to start a baseline, and we want to lower inflammation and increase tear production. So, that's why we're using something like this and saying, okay, well, in our clinical experience, this is why we did what we've done. I'll let you go ahead and talk a little bit about GLA.
When I was in training, I was told omega-6s are bad. Well, and then I read this paper showing improved dry symptoms in Sjogren's patients using omega-6 supplementation. I'm like, hold up. That is totally counter to what I was told and what I believe. But when you go looking into the biochemistry of going on, it turns out if you have the right omega-6, particularly in combination with the ideal ratios of DHA and EPA, that's where the magic is. So GLA is comes from blackcurrant seed oil. It's a plant-based omega-6, and that's where the secret sauce is. You get, at the end of all that fancy biochemistry, you get something called prostaglandin E1. And that is like Glinda the Good Witch, right? She just comes in and creates peace everywhere she goes. That's why I chose pink flowers today, because I love her gown.
You're telling me something very disturbing, and that is, so omega-6 like pizza and hot dogs and hamburger, those don't help?
Not so much. So this ideal ratio that's found in the formulation of HydroEye is what compels me as a clinician scientist. You know how much I love cytokines and immunopathophysiology, and I like to totally geek out on that stuff. Well, there's all that evidence surrounding this formulation, and GLA not only helps to promote that anti-inflammatory situation, but you actually also stimulate output from your lacrimal gland. And maybe that's why we're seeing improvements in osmolarity in our patients when they come back.
And I had a great conversation with you when COVID first started, because you were so excited because they were talking about cytokine storms. And it's like, we're going, yes, that's what we have dealt with year after year in dry eye. Cytokine storms in the eye. So it was like, okay, at other people's expenses, we kind of thought it was interesting.
Cytokines are awesome. And they talk about cytokines in this paper, and not only cytokines, but also cell surface markers of inflammation. And they actually were able to show a reduction in some of the cell surface signals that attract the inflammatory cells to the ocular surface. Calm those down. Those activated T cells can't find their way to the chaos scene, right? They're like, where am I going? I don't really know. Move right on by, right? Not in my house. Right?
And you mentioned such an important point on this, and that is that it is a controlled balance between omega-6 and omega-3s that make all of this work. And so I think, to our viewers, you really have to tell patients when you're putting them on a gamma-linolenic acid is don't let them take omega-3s at the same time. The amount they need is already incorporated.
That's right. And then it throws the ratios off, and it's the ratios where the magic is happening.
Yeah. And this was a great peer-reviewed paper that was done by John Shepard. I thought this was a really meaningful paper that looked at that and really showed, and which is interesting, there's actually more class 1 studies done on omega-6 and omega-3s.
That's a good point. And you're a science-driven person as well. And those papers are such a worthwhile read. If you're still confused about omegas and their role, dig into some of this peer-reviewed literature. It's fun. Something we haven't talked about much in the dry eye world is the upstream events that contribute to inflammation, and the antioxidants found in the formula help to prevent that way upstream oxidative load, oxidative stress, activation of reactive oxygen species, which independently add to the inflammation drive. So you get not only support for the back end of the inflammation, but you also get support to stop the upstream downpour into that cycle of inflammation.
Completely agree. Anything else that you particularly find in selecting your supplement that has been an advantage for you?
Absolutely. I want to focus on that fish smell, fish taste thing. When, to your point earlier, when patients go to the Costco and buy the krill oil or whatever this is, or the some kind of off-brand fish oil from the drugstore, the fish burps are no joke. Like if only the neighborhood cats want to follow you around, you're not taking the right kind of omegas. So you're not going to have the tuna can effect with this product. So I think that's very important. Tolerability, I have found outstanding tolerability across the board in my patients. And I love the fact that they give a satisfaction guarantee. I think that's key. I expect it to start feeling better in about 30 days, and that's borne out again and again in my patients.
And that's a great point on the smell and the taste. And one of the things I tell patients is the amount of omega-3 you need to take to affect inflammatory-based dry eye is very high. And what I find is when I get up to those doses, some people do fine with it, but some people also just don't tolerate that kind of level of that omega-3, and hence the fish burps and the aftertaste and the cats following them around.
Meow.
Now, the other thing that, as we look at over-the-counter products, I think that the importance aspect is, to me, I kind of look at, take that step, get started, have something that you have some type of a system, where we're going to talk about the different systems that are available, but having something so that when a new product does come along, like makeup or like this Sleep Right Eye Seal, then you're posed to actually introduce it into your clinic seamlessly. It's kind of like having a CLIA waiver and being able to do osmolarity, inflammation, and any other biomarker that happens to come along. You're posed, your practice is ready. An example of this is just this Sleep Right Eye Seal. That is something that's just, it hasn't been commercialized yet, and it really deals with lid seals insufficiency at nighttime, which is driving so much of these patients when we have recalcitrant dry eye. And we've used moisture goggles before from companies like Aiko that keep the eyes in more moisture, and for those that wear it, that'll work. But this actually keeps the eye closed all night long and dramatically drops inflammation. And as we were working in this clinic, it was just a natural. We just were able to add it, and we were able to have it available. It's kind of a picture of how this works. Very easy to use for one eye, really easy for two eyes, a little bit more, and it will be an over-the-counter product. But my practice was ready to get involved in the research, adopt it, and as we started rolling out, it was so easy to integrate. And as we look at something like a eye hydrating compress, a Bruder mask, something that has been so commonplace in the eye care world, that we're using this, and that is the science, once again, the science behind something like this, and it's so well accepted by patients. Do you use this?
Yes, we do recommend a heating mask for many of our dry patients. I find that the advanced rosacea MGD patients can't really tolerate the heated masks until after they've come under control with their IPL treatments, and then they can tolerate the heating packs much better. Have you found the same thing?
Yeah, and I use this again as a setup. I mean, this is a foundational treatment that I use for somebody, because I want to condition them. When I see MGD that I'm going to be treating down the road, I want them conditioned for this to help maintain what we did and what they spent money on in, whether it's IPL, whether it's thermal pulsation, that this is something that's going to help maintain. And if I introduce it early enough, they accept it. And then it's like anything else, it's their decision.
Nice.
If they want to do it,
simple thing to bring on board.
Very, very simple.
Very simple.
And this becomes foundational treatment as well. Right along the idea as looking at lid scrubs and having the lid scrub that works for you in the practice. And these are just kind of simple examples of how you can dovetail in the practice and select those products and feel very comfortable. I would imagine, because I heard you talk about using new lids on patients, and that lid hygiene is a major player in your practice as well.
There's a really cool cell culture paper that was published in 2020 showing that certain concentrations of tea tree oil with prolonged exposure in cell culture contributed to the death of those cells. However, those were long exposure times in cell culture, and at a certain low concentration of tea tree oil, there was no cell death difference compared to controls. So I think there's a lot of fear right now around tea tree oil, but when you look at these low concentrations in rinse-off formulas, I think that there's a lot of room for, further scientific investigation for sure, but I'm not ready to not use tea tree oil, because there's a translational component to cell culture science and what we're seeing in vivo. Those microglial stem cells are a long ways away from direct exposure to the tea tree oil.
And when we're talking about that, we're talking about cell death. We're talking about Demodex death and things like that with the tea. I mean, Laura's one of the sweetest, kindest person, but she will nuke a Demodex in a heartbeat. I mean, I've seen video where she has just nuked these Demodex. So
with nefarious laughter.
Don't let her fool you. Laura, there's also some questions coming in, in regards to, because we kind of covered the nutraceutical end. And, one of the questions is, how long does it take HydroEye to start working for patients?
Well, I'd be interested to hear your clinical experience, but anywhere from 4 to 6 weeks. I'm going to show you a case that made me a believer.
What's interesting is I find that that run-in period of 4 to 6 weeks where it really starts having effect. But if somebody discontinues it for a week, they come back and they say, man, I stopped it and it made such a difference. Have you experienced the same thing?
I've noticed the same thing personally. I suffer from dry eye as well. And if I slack off, I get reminded. That was my...
Yep. And, another question came in pricing, and we're not going to kind of cover what we do, but I mean, doctors are free to set their own prices on this, on their over-the-counter products. I personally like to keep it very competitive. So I don't want, somebody to go out and shop me and say, oh man, this guy's twice as high. I try to keep it competitive because I'm providing a convenience aspect as well.
Nice.
And what about, and we'll talk about specifically supplements right now, because we're going to cover some of the other products. What about stocking the product versus referring and redirecting the patient to websites and to other stores to get the product? What do you do, Laura?
With our brand new clinic, we don't have the space yet to stock and dispense the OTCs in the mindful way that you've done. And I hardly agree with your model. It's important to have that curated selection of mindful OTC foundational supportive strategies for your dry eye patients. So we're moving towards that model. We do a little bit of education around some of the delicious science around our newer generation artificial tears. Preservative free is always my go-to as a cornea specialist. But yeah, we're moving in that direction slowly. And again, I look to you for inspiration because you always inspire me, Doug.
Oh, thank you. And there's another question in terms of asking about the what do you recommend in terms of HydroEye per day? And I'd like you to answer this first because I want to see if we're doing the same thing.
As far as the dosing concerns, well, I'd say, gosh, 90% of my patients, it's the 2 capsules PO twice a day. Unless you're like 100 pounds, teeny tiny, then I might lower the dose. Or I haven't think of many examples where I increase the dose. But I say, 90, 95% of the time, 2 capsules PO BID.
Exactly the same thing. I mean, that's what I start off with. And I'll tell people that, when I get, a tiny person like you that comes in, then I'll say, we may be able to titrate this dosage, but when you have a beast like me, you're going to be on 2 capsules twice a day. So.
It's all that time in the gym.
All that time during COVID in the cookie jar.
Not judging.
And really, you got to set the stage. Patients need to understand the benefit of why they're doing. And this is where staff, and there was a question, in regards to, onboarding staff and what you do and how you do that. And one of the ways I find that staff gets on board is get them on the product, so they have an understanding, do the procedures on them, have them an integral part, because without staff, we just don't have enough time to do everything. And I think that staff really has to, in my opinion, I should start a sentence and they should finish the sentence.
Nice.
And then we really need to take a look at our business models and what we want to do. Do we want to, like we just talked about, carry inventory, refer patients? And really, I now use a hybrid, like with HydroEye. They're walking out with their first 2 bottles. I want them to have 60 days to see if it's going to work. At the same time, I give them an order slip and say, call these people, give them this number, call this number, give them this number, and tell them you want this shipment. They'll ship it to you at no shipping charge, and they'll give you a discount on that. So I like to get them going on. I like to tell them, hey, I'd like to do whatever's going to benefit you, so they don't have to keep running back and forth. So I really use, on most products, kind of a hybrid form now.
I think that's really smart and decreases some of the stress of keeping track of inventory. I really like that idea, like the intro pack, if you will, and then the handoff for the maintenance. I think that's smart.
Yeah, and also, I mean, with freshness of the product, whether it's artificial tears, lid scrubs, I mean, when it's coming directly, from a source, in this case, where it's coming from the manufacturer, it's going to be good. It's not going to be resold 3 times. It's not going to be somebody who is stockpiling this stuff and sending old inventory out to patients. Because I've had that happen where patients say, well, I ordered this and I got all these capsules were stuck together, and somewhere it's like, okay, it went through some serious overheating.
Probably in the back of somebody's car in Arizona or something. That's not good. We want to maintain quality.
Yeah. So, with stocking, really, it's a fairly minimal investment when you do that, but then you're managing an inventory. And, and I would get so frustrated with employees when they'd say, oh, yeah, we ran out of that. It was like, and you didn't say something about that. And I realized I didn't hire them to be inventory specialists. I didn't hire them. I hired them to be compassionate and get information from patients and process patients, and realize I was just asking too much. So that's where I've really gone into the hybrid model, where, we do it. We try to know before the last box is handed out, or the last bottle, whatever the product may be, then being able to set the patient up. I just don't leave them on their own to figure out where they're going to get it. I don't do that.
Awesome. And have you come across any really clever inventory management systems that are linked to your practice management point of sale type program? I mean, that sort of streamlines the process and takes the human error element out of it.
It does, and you can set minimums and maximums in there that you regenerate orders during that. QuickBooks has a good one within it, and as a little disclosure, before I went to optometry school, I was in logistics and managed a 44,000 square foot warehouse where we had 18,000 products, and we really had to keep on top of those. And so the management systems can get pretty sophisticated. You can do it with a card system where you just watch and you have a minimum level that when you go, the staff generates, or you can get into something like QuickBooks that will do that as well. But great question. Using the team approach. I mean, everybody on board, we talked about that. Use the reps to put on in-services. I mean, you get a lunch and learn, they come in, they present, and just make sure everybody's on the same page. I think, I have my dry eye coordinator, and he's so valuable. I couldn't do what I do without having that dry eye coordinator. And I think that having a point person, having somebody that is that coordinator is so important, and give them ownership. I think if you give somebody ownership of the dry eye franchise, they really will embrace that, because they feel as well that they're helping that patient just as much as the doctor is. And I know you mentioned, you showed in that makeup picture, you have that right-hand person as well.
Yes, worthy cause and a trusting team. That's all you really need to get started.
Yeah, mine's a Louis. And he looks intimidating, but I always say, you got to get yourself a Louis, and in contact lens practice, you do that. You set up your contact lens coordinator, you set up, and you give them ownership. And I think utilize the reps. So I think it's so important. If you utilize the reps, you're going to have success, because they want to get everybody on the same page with that.
And they're super knowledgeable about what makes it special.
Oh, yeah. Yeah. I mean, I'm always impressed with the information that the reps will have. Now, I do get a kick out of it. This was years ago, and it was the only cyclosporin. It was the only dry eye treatment out. And we had a rep come in, and they were so excited to present to a doctor. And he said, can I tell you something about cyclosporin? And I said, yeah, sure. You can tell me something about it. And I said, by the way, and he started into the whole thing with the product. And I said, by the way, do they ever give you a list of people that say speak for the company or advise? And he goes, oh, yeah, we get that list. I said, okay, well, go ahead. And then he goes on. And I said, after about 5 minutes, I said, okay, I got to give you a little disclosure here. He just totally turned red, said,
Oh,
but when you really look at the patient flow, it starts at the doctor recommendation, and it also, and we're going to show some displays that can make that also, and then the tech reviewing things, giving patient literature is so important. I mean, I'll typically will tell patient, okay, here's what we're going to do. We're going to start you out on this. If for some reason they don't have it, they also get, in addition, especially if they don't get it, the literature, and give them a brochure so they have an understand. And then it's followed through from the time I mentioned to them to all the way through. I'm sure similar methodology within your practice. Let's talk about how you can fail in OTC products. And we mentioned one of the ways you could fail is by getting the grab bag approach, where you hand the patient just a ton of samples and let them go on their own.
Mhm.
I mean, that certainly
It's
is
overwhelming.
Yeah,
I only like that when I go to the cosmetics counter of multiple samples.
I'll take that sample and that sample.
Or
And
the
then,
perfumes. I love perfume.
and then if you try to do everything yourself, it's tough. I mean, you can't handle all of it as the doctor, and can't do everything. And really not having a system, not having somebody, as we talked about, is so important. So really, the other thing that's important is talk about why you're doing something, and then address it on the follow-up. I always go over the treatment, whether it's over the counter or prescriptive, of what I'm doing, and I try to give them results, where we are at a certain point, what it's doing for them. And I just reinforcing, yes, like something I'll say, the HydroEye is lowering inflammation, is increasing tear production. And it looks like, based on the MMP9s and the testing here, this is what we're seeing, looking at the speed scores of the OSDI scores, looking at osmolarity, looking at the staining. I always equate it back to the treatment they're on. Laura?
Yes, totally agree. Like, patients forget to take it. Like, you start a good habit, go to the gym every day, sort of may fade a little bit, and then you don't get the results you're expecting. And this is really no different. And humans are human, right? We need little reminders, little nudges to get on it and stay on it.
Well, and being a sole practitioner, this question that comes in, talk about how you get other doctors on board in your practice. In your previous practice, I know you had problems with that, getting doctors on board, and how they would just brush some of these things off. The tips I can have on that is go to the docs and the providers that have the interest and are willing to carry it forward, and try to get those patients referred into your clinic at that time. Any suggestions that you have on that?
Well, you can always try the kill 'em with kindness or the blunt approach. It depends on the dynamics of your office. I recommend any approach that works.
Yeah,
And if not,
it is.
go on your merry way, and then make them jealous on the back end.
That's right. It's sometimes that question is a great question. I appreciate it coming in, but sometimes it's walking a tightrope. All you can, and it boils down to everything: education. You got to give them the education,
That's
and
always the common denominator.
the education and science. I mean, that's what we're surviving on these days, trying to do that. I know this is a case you had. Why don't you go ahead and talk about this?
Well, I loved your story about how you became a believer with HydroEye, in that 1 month of like, this is the only thing I'm changing, and having that really exciting feedback that you had. Well, I was a dabbler, like in 2016. I'm like, yeah, it doesn't seem like there's enough there to do what I want it to do, and I'm not so sure. Well, decided to try it out a bit. This was a busy executive who came in before the holiday season, and he had type 2 dry eye, definitely was symptomatic, had a positive MMP9, osmolarity was out of range, and I sent him off with my sophisticated treatment plan, to your point earlier. And he came back in January after the holidays, and the only thing he managed to bring into his dry eye management was HydroEye. He wasn't able to fill his prescriptions. And the reason why I was able to fill it, because he's in the tech industry, is like, oh, this is easy, bing, bing, done, it's coming, right? You have to make it really easy for people, right? So he was able to do that, and that's the only thing he was able to do. And he came back in, his symptoms were so much better. The inflammatory went from moderate positive down to just barely there, and his osmolarity was below 308, still big, more than 8 osmolarity difference, but looking better, feeling better, less staining, like all that stuff. I'm a hero. So I'm like, this is the case that brought it all together for me. All that nerdy science I've been reading, all that biochemistry that I love, all that immunopathophysiology, and brought it right in front of my face. Okay, now I get it.
Yeah, and sometimes you need those type of things that makes it, and time again, those patients that come in and go, yeah, you know, I ran out of it, and you know what they were doing? They were kind of testing the water, saying, okay, if I don't take this for a while, is it? Because how many times did we see that on cyclosporin?
Right.
And
Or they'll just put the medicine in one
say,
eye. I'm like, no, don't do that.
Yeah. So let's take a look and really more getting the, you know, achieving success is really just show how the over-the-counter product fits into your overall plan, that it becomes part of your comprehensive treatment that we have. And, you know, the way I explained to my advanced site, you know, that my goal is to get them to maintain at this level. Once we back it up, and we'll start out aggressive, we'll back up. And again, if I can get somebody that just is maintaining, and they're doing warm compresses, they're doing something like HydroEye, they're doing lid scrubs, and they're maintaining their physiology then I think that's a great success. Unfortunately, a lot of patients won't. They just simply won't, because of the whole compliance issue. But when it becomes a big enough problem, they will. Yes. At that point. And I also think, you know, don't over-explain, don't get way into the weeds on things. I always like to give patients what they need to know and reinforce that several times. You know, if you're recommending something, have the conviction of what you're doing, you know, and that's why having your staff on these treatments, having yourself on those treatments. I mean, you know, you mentioned that you proved it in an N of 1, that if you don't take it, you notice the difference. So
I do.
Yeah. And really, and the other thing is, I always say, I'm going to prescribe this for you. I don't recommend it. I tell them this is what you need. Mm-hmm. And, you know, I feel very positive about taking that approach with the patients. And then the other thing,
I think some of our colleagues can take the approach of being invested in their comfortable lifetime vision. This is such a simple thing you can do to help keep your eyes healthy.
Yep. And, you know, if we're doing what's right for the patient, the money always follows. You know, you have to have the organization, you have to have the accountability looking at it, but the money always follows. I found, do the right thing for the patient, and it's going to work. It's going to work out financially. And I always say, you know, when you're really creating healthy patients, you're also creating a healthy practice, in that the revenue streams are going to follow. And there's so many different revenue streams in over-the-counter products, in procedures, and things that we can do within our clinic. And you're a great example. That's what you do, is your clinic is ocular surface conditions. So the other thing we tell the patient, and I think this is, you know, if a patient comes up and says, well, I'm just going to go to the drugstore. I mean, what I always tell patients is, we offer the following products as your convenience, so you have it. And the vast majority of patients will go, great, because they don't have time to run around. They don't have time to
they forget.
And they forget. Yeah, they forget. So, and I just put it as for your convenience. And the staff will say, well, you know, you'll find that these are very competitively priced. The staff will help a little bit with that if somebody, but they don't push them. If somebody says, well, no, I'm just going to do this. Okay. You know, you won't find this product in the drugstore. You won't find this. This is recommended by the doctor for a specific reason. So the front desk also helps that, but it's not a pushy type of situation. It is more for compliance and for convenience of the patients. And that was originally, when I got into all of the stocking and doing that, it wasn't for profit, it was for compliance. And I thought that, you know, having some merchandising, having the compliance, showing them that you have the products and multiple products, you know, that it just helps let them know. So we have this little case that we put up there. So, you know, in the last few minutes, let's talk about, you know, what this means in terms of dry eye and what you do. And these are just simply, you know, most of these are just right off of a patient ledger. So reappointment level 2, which I almost never have, unless it's just the staff doing something, is going to be reimbursed about $45. The majority, which is level 3 based on exam history and medical decision making, is going to be at a level 3, and some level 4s with the complex patients as well. Some punctal occlusion for the patient's going to reimburse over several $100s on a bilateral. Anterior segment photos, looking at amniotic membranes, and actually this came right from patient ledgers, but I've actually had amniotic membranes reimbursed at over $3,000 for a single place on that. And doing the testing, the osmolarity testing, the inflammatory, doing imaging, all of this can bring really nice returns to the practice. When we look at doing procedures, look at BlephX, at Demodex treatments, and then we take a look at just at supplements. I mean, the supplements alone, if they come through your practice, are going to amount to about $161 in net alone. And you say, okay, well, that just gets added to these patients that really, and then when you're looking at scrubs and tears and masks and moisture eyewear, that can then be another $196. So you're looking at over $350 that is a net to your practice. And then when you look at your dispensary, how many, with glasses and contacts, how many of them do that? So, if you provide the service, if you're providing the convenience, the financials will absolutely follow. And then as we just look at some bottom line examples on this, on when you talk about 4 visits and then adding scrubs and diagnostics, and 4 visits and then adding procedures and adding membranes, all of a sudden you're looking at an amount for a patient that could be, anywhere from $2,000 to $3,200 when they're having multiple procedures. The most important thing is the level of care that you're providing for the patients. Any other questions or any other comments that that you'd like to address, Laura?
Thanks for always being such a great leader in the space. You inspire other people, you lead the way, and it's awesome to be here with you today, and it's awesome to be your colleague and friend.
That's the nicest thing somebody could say to a dry eye junkie like me, because I love it. I love the science. I love helping people. And, when I get a patient and they go, nobody's been able to help me, and I'll say, you know what, stick with me and I'll stick with you. We'll get this taken care of, because I love solving mysteries. But thank you for that wonderful comment. And thank you everybody for joining and talking about the over-the-counter and adding that as the foundational treatment for all of your dry treatment. Thank you, Laura, so much.
Thank you.
Always a pleasure to talk with you.
Can't wait to see you in person.
Okay, yeah, I know. Bye-bye.